So, hello students. A lot of demand from the students regarding important topics of embryology from exam point of view. So, let us discuss the commonly asked questions in embryology. I'll just give you a list. Clinical case related discussion will have somewhere else in the case discussion studies. So, let us understand some important topics which are asked from embryology, as embryology anyway comes as a short note, right? So the first and the very important topic from general embryology, the first one is primitive streak. So you have to write how the primitive streak is formed, how the epiblast grows, right? What is primitive node, what is primitive pit, the functions of primitive streak, the formation of notochord, and the three germ layers. The fate of primitive streak, it disappears. If it remains, it results in a sacrococcygeal teratoma, right? And you have to draw diagrams for that. So that's primitive streak. Second, extraembryonic mesoderm. Extraembryonic mesoderm is the one which is outside the embryo. Outside the embryo, it's between the amniotic cavity, Yolk sac, and the cytotrophoblast. Now there are cavities which are formed here. The extraembryonic coelom which is formed, which divides the mesoderm into a splanchnopleuric and a somatopleuric layer. Same as about the intraembryonic mesoderm, which is between the ectoderm and the endoderm on either sides of the notochord. The intraembryonic mesoderm differentiates into a paraxial, intermediate, and lateral plate mesoderm, and you have to know the derivatives of each one of this. So extraembryonic, and I'll just make it here, intraembryonic mesoderm. Intraembryonic mesoderm. Fine. Okay, so both you remember. Now chorionic villus. Always asked what is a primary villus, secondary villus, tertiary villus. The fetoplacental barrier. Now this can be asked on embryo table Viva also. Right students, there's a Viva, embryology Viva table. So all these things are asked during the Vivas also. What is a primary villus, secondary, tertiary villus, right? What is a fetoplacental barrier? Neural tube and its defect, like how the neural tube is formed, how the ectoderm folds inside, what is neural plate, what is neural groove, how the neural tube separates, what is cranial and caudal neuropore, when do they close, what is anencephaly, what is spina bifida, everything I've discussed in the lectures. Go through it and understand it, and that is what you have to write. Amniotic cavity and Yolk sac, how the amniotic cavity is formed by the proliferation of epiblastic cells, amniogenic cells, how the hypoblast is formed by the proliferation of hypoplastic cells, what is the primary, secondary, and tertiary Yolk sac, what is the function of Yolk sac, formation of GIT, what is Allantois, what is the fate of Allantois, what is the function of amniotic cavity, what is polyhydramnios, what is olighydramnios, and what is amniocentesis. Okay, that is a prenatal diagnosis investigation done before the birth of a child, amniocentesis. Fine. Next is formation of notochord. Another very important topic, that's formation of notochord. How the notochord is formed, right? The primitive notochord or the notochordal process. Then there's a notochordal canal. Then what is neuroentry canal? Then the notochord separates. What is a definitive notochord and what is the fate of notochord, right? Formation of nucleus pulposus and the apical ligament of Dens. That is what you are supposed to write. Regarding placenta, the fetal part, the maternal part, what are cotyledons, what is chorion frondosome, chorion levi, that you have to write. What is decidua basalis, decidua parietalis, decidua capsularis, and which is a part which takes part in the formation of placenta, the chorion frondosome and the decidua basalis, that you are supposed to write. You have to write the functions of placenta, and you have to write about the blood flow of the placenta. Okay, how the blood flows in the placenta, and how the exchange of gases takes place. What is fetoplacental barrier? So these are the important questions from general embryology which are asked. This can be also there for the table Viva. So remember, everything that I'm telling is important from Viva and from the theory point of view. Now, abdomen and pelvis, the parts of GIT, the foregut, midgut, hindgut, the derivatives of all these parts, always asked in the exams, Vivas. What is Meckel's diverticulum? That's a short note. What is Wittline duct? What is a fecal fistula? The proximal part, if it remains as a Meckel's diverticulum. What is the Meckel's diverticulum? What does it mimic? How It mimics appendicitis that you have to write. Rotation of gut. Okay. What is physiological herniation? When does the midgut loop herniate out? 6 weeks. When does it return? 10th week. And what is the normal rotation which takes place? And what are abnormal rotation? What is mixed rotation? What is non-rotation? And what is a reverse rotation? That is something important. Then derivatives of dorsal and ventral mesogastrium. Table Viva is always there on this. Ventral mesogastrium, the lever forms. So all the ligaments of lever forms in the ventral mesogastrium. Dorsal mesogastrium, the spleen develops the gastrosplenic line-orenal ligaments which are formed there. Fine. The gastrophrenic ligament. Development of stomach from the foregut, the rotation of stomach, how the lesser curvature, greater curvature is formed, how the lesser sac is formed because of the rotation of stomach, that you have to write. Pancreas, the dorsal and the ventral pancreatic bud, how they fuse, what is annular pancreas, what is pancreatic divisum, what is the dorsal bud form, ventral bud form, what is the main and the accessory pancreatic ducts. Everything is very important. What is the annular pancreas and pancreatic divisum. Development of kidneys, the collecting part, secretory part, how it develops separately. Okay, the ureteric bud, how it goes towards the metanephros and stimulates the metanephros to form the secretory part of the kidney. If the ureteric bud is not there, it results in renal agenesis. Failure of communication of collecting and secretory part results in a polycystic kidney. So what is the secretory part form? What is the collecting part of the kidney form? That you have to write. And why does the kidney ascend up? What is Bochdalek's hernia? And development of diaphragm, that is also important. Diaphragm. So development of diaphragm, Bochdalek's hernia. Fine. So all these things are important. The pleuroperitoneal membranes, the dorsal mesentery of the esophagus, the septum transversum, and the body wall. Muscles are derived from cervical myotomes. Cervical myotomes, not occipital. Occipital myotomes, what develops is the extraocular and the tongue muscles. Fine. Then development of urinary bladder, how the urinary bladder is derived from, what is hindgut, what is cloaca, what is urorectal septum, urogenital sinus, and definitive rectum and anal canal. Urogenital sinus forms the bladder and the urethra. And what is allantois, how it communicates with the umbilicus. What is median umbilical ligament, what is a weeping umbilicus or the urinary fistula. All these things are very important. Anal canal, the development of anal canal, endodermal and ectodermal part. What is white line of Hilton? What is dentate line? What is the importance of dentate line? Anal columns. Then anal canal is anyway very important. Internal anal sphincter, external anal sphincter. What is imperforate anus? What is a fecal fistula? Okay, or a fissure in ano, a fistula in ano. Development of uterus, the fate of mesonephric and the paramesonephric ducts in males, females. The mesonephric tubules, the development of external genitals, the genital swelling, the genital folds, the genital tubercle. What does it form in males and females? How does the paramesonephric duct forms the female genital system? How does the mesonephric duct forms the male genital system? Everything you have to know. Okay, uterus. How is the vagina formed? The upper 1/3 is derived from paramesonephric duct. The lower 2/3 of the vagina is derived from the proliferation of sinovaginal bulbs, which are derived from urogenital sinus, that is endodermal. The upper 1/3 is paramesonephric duct, that is mesodermal in origin. Fine. So this is about the abdomen and the pelvis. Plenty of big list. And embryo should be clear, students. If your embryo is clear, your next year pediatrics is going to be very easy. Gynec is going to be very easy to understand. CVS, interatrial septum, interventricular septum. Okay, AV cushion. If the AV cushion is not formed, there occurs interatrial and interventricular septum. Phalloid steatology, the 4 conditions in phalloid steatology. The cause of phalloid steatology, the primary cause is the shifting of aorticopulmonary septum to the right side, pulmonary stenosis. That's the main cause of TOP. The development of the various aortic arch arteries, the arch of aorta, the subclavian, the pulmonary trunk, the common carotids. What is a double aortic arch? What is the abnormal right subclavian artery that you need to know? Formation of SVC, the anterior, the posterior cardinal veins. Anterior cardinal veins, anastomosis, the formation of SVC, the formation of coronary sinus, the formation of azygous vein, the formation of IVC, and the formation of portal vein. Everything is important. All these veins formations are very important. Renal vein, portal vein. The 3 veins coming to the sinus venosus, the umbilical, vitelline, and common cardinal vein. Fetal circulation, very important. That model is always there for the theory table viva. Table viva, fetal circulation. The fate of various components in fetal life, what happens to it in adult life after birth. Development of lungs, the canalicular phase, all those 4 phases that you need to know about the lungs. And how does the esophagus develop? I mean, how does the trachea develop from the foregut? And what is a tracheoesophageal septum? How it separates the trachea and the esophagus? What is the tracheoesophageal fistula? That you have to know. Fine. So same can be asked in a clinical question type case presentation. The same embryo question can also be asked. Fine. Regarding head and neck, the ectodermal, endodermal pouches, the fate of the pouches, the arches, the derivatives of the arches, the development of tongue, thyroid gland, the development of face, what is cleft lip, hair lip, oblique facial cleft, development of hard palate, what is foramen cecum, what is incisive foramen, right? So this is very important. The nerves of the pharyngeal arches, the muscles derived from the pharyngeal arches, the derivatives of the pharyngeal arches, the muscles, the cartilages, the nerve and the artery of the arch. Development of face is another very important. Table viva always asks on development of face. Okay. Then thyroid gland is derived from the tongue. Development of tongue is another very important theory question, practical question also. By default, it is always there. Then the derivatives of neural tube. I mean, the derivatives of neural crest, not the neural tube, the derivatives of neural crest cells. The derivatives of neural crest cells. So neural crest cells forms many derivatives. We have already studied that. So just remember that derivatives of neural crest cells. What is alar lamina, basal lamina? Okay. So when the neural tube is formed, there's a canal, central canal, there's a neuroepithelial cell. This neuroepithelial cell forms a neuroblast. The neuroblast will now form the first layer around it, that is the mantle layer, which has cell bodies, and the next layer which is formed around it is the marginal layer. Then on the dorsal part, that's the alar lamina. On the ventral part, that's the basal lamina which is formed. The basal lamina forms all the motor part, the alar lamina forms the sensory part. The various dilatations of the neural tube, the prosencephalon, mesencephalon, rhombencephalon, and what is derived from the prosen, mesencephalon, rhombencephalon, the various cavities of that part of the brain vesicle. What is diencephalon, the thalamus, hypothalamus, epithalamus? What is the epithalamus made up of? The metathalamus, the subthalamus. All those things you need to know. Fine. Anything which is left here? The diaphragm development is another very important thing. Now see, this embryology comes only as a short note. It can come with a LAQ or it can come as a separate SAQ for you. In practicals on the table viva, embryo is always difficult for the students. Students, at least prepare 3-4 proper embryo topics. You see the models which are there in your college. I'll be making a lecture on the models also, embryology models. So you are well aware of the models and you are well aware of what questions the examiner is going to ask. So I have given you a list of important questions. Okay, just read all these questions, prepare these answers, discuss with your friends, be confident in answering all this. Fine. So that's my YouTube channel, the Telegram and the Instagram handle. On the Instagram also I have small reels which are made, which are very important from Viva point of view, which will give you an orientation to what questions can be asked in the Vivas and how confidently you can answer those questions. Right, students? So I hope everything is covered here. Anything which is left, you can let me know. Okay. Neural tube and defects is clear. Anencephaly and spina bifida. Fine, no? Okay, formation of lesser sac. That's very important. Epiploic foramen, greater sac. Okay. I hope this should be clear. Formation of IVC model must be there in your individual college. Just look at that. Formation of portal vein. Okay. I hope this is clear to all of you. Students, just refer to all these questions, prepare short notes and prepare yourself for the table Viva. Okay. In case of any doubts, do get back to me. Thank you so much. Thank you. Bye bye.